In the current context of Malaysia and marginalized communities and NGOs helping out, do you see maybe in the future that there needs to be NGOs, like you said? It's important that we need to have NGOs, but do you see that government coming in and trying to solve, because it's important that we solve the actual problem of why this happens and why there's these marginalized communities, why they're not getting the help they need? Do you feel like maybe in the future we could see a country that does not require a lot of NGOs to be operational? Would that be a perfect world thing, a best case scenario in that way?
I believe very strongly in the role of government, Dishen. I am pro-government. Not necessarily for the ruling coalition, because this is an individual choice, democracy and so on and so forth, but I believe in public service. I believe in a strong role for government to take care of its people. There is a moral role, philosophical role, legal role, ethical role, all of which we will not discuss because people instinctively know that. However, I don't believe in an ideal world where only government takes care of everyone. I believe in a vibrant NGO society. A vibrant NGO society where you and I can participate. We choose a cause that we participate in, and that cause could change. In your 30s, you want to work with urban poor. Good. In your 40s, you want to work with the disabled. Good. In your 50s, you want to work with orang aslis. Good. Whatever you do, you pick a cause. And it could be the same cause forever or different causes throughout different periods of your life. Human beings need an outlet. Human beings, but also citizens need an outlet. And you and I, fellow Malaysians, we have a duty, I guess, a moral and legal duty to the 32 million Malaysians who are our brothers and sisters to also help take care of them. We can't just rely on government. I believe in a strong government, but also a vibrant NGO society. Before I go on further, can I tell you in very broad terms, although I love NGOs, there could be a systemic problem with the existence of NGOs though. Okay. Everything has good and bad, say advantages and disadvantages as well. If we have a reliance on NGOs, the first risk is that government, we don't care. NGOs will solve the problem. And there is a danger in that because we need government and NGOs to solve the problem together. Government cannot just say, NGOs will solve all my problems, I don't have to deliver on my services. Therefore, they have failed in their moral and legal responsibility. NGOs could be dangerous that way. The second way of NGOs being dangerous is that NGOs, by and large, are focused on the short-term need. They don't do the long-term advocacy. If you only focus on short-term needs and you draw the public attention only to the short-term needs that's right in front of you, we're missing opportunity to bring the narrative, as in Malaysia's narrative, to the long-term systems and infrastructure building. The example that you gave is very true. Assuming an NGO works with homeless people in the urban space, right? And it makes a lot of social media, say, attention focus on homeless people. I think that's great. But solutions cannot be short-term, they must be long-term, and government must have the patience and the courage to say, this needs a long-term structural solution, and I'll partner with you, NGO. Let's not focus on the short-term urgency needs. Of course, we need to, I'm not saying we don't, but let's also focus at the same time, simultaneous to the short-term, on the long-term goals as well. Let's go back to the vibrant NGO society. Strong government, vibrant NGO, win-win, so that all of society is not left behind. So that's where I see this ideal scenario where there's a role for NGOs, but also noting that there are potential dangers in it, and partnering NGOs partnering governments in a way that that's not blaming, shall we say. Sometimes it's a blame game. Perhaps in Malaysia, perhaps certainly in many other countries where NGOs accuse the government, and the governments therefore don't like the NGOs, and then it becomes a vicious circle where they don't trust or like each other. We can't have that in Malaysia. We need to have a partnership, a strong government and vibrant NGOs partnering together.
All right, Doctor, let's move on into maybe very interestingly, we've been talking about NGOs, the whole creating a vibrant NGO community and also a government that supports and works together with NGOs. So, in our current situation in Malaysia, what are the steps that we can actually take for that to happen?
Dishen, I will have a few ideas in my mind, but I'd like to focus them on health NGOs. Because there are so many other NGOs, education NGOs, economics NGOs, livelihoods and so on. Let's talk about the health ones. I offer 3 thoughts to create that partnership between government, a strong, confident, secure government, and a vibrant NGO community. The first step is, let me call it a secretariat. We can call it whatever we want, but let's call it a secretariat.
Okay.
In that secretariat inside the Ministry of Health, it could be in a way that it combines the efforts of all the NGOs. The Ministry of Health probably at the moment doesn't know who's a health NGO. We should have a list of NGOs, and then we can map their needs, meaning including where Malaysia's needs are. And if we're confident enough and we share the information with them through the secretariat that organizes the NGOs, we're not trying to tell them what to do, and we shouldn't tell them what to do. They should have the freedom to decide what they want to do, but they lack information, they also lack coordination. Information is, I want to do this, but I don't know that this need exists over here. If we can give them this information through the creation of a secretariat to share information, however it takes place, for example, an IT system or a platform, for them to share the information, it would be a good first step. The second thing I can offer, the idea I can offer, is an MOU. The MOU is a powerful tool to lock the Ministry of Health and an NGO in a way that makes sense for them. We talk a lot about public-private partnerships, but we don't talk enough about public-private or even CSO, civil society organization, or NGO partnerships. Wouldn't it be great if the government will be able to sign an MOU with an NGO? And in that MOU, and I could maybe suggest Mercy Malaysia or Malaysian AIDS Foundation as a start to solidify where the Ministry of Health will operate and where the NGO will operate.
Talking about long-term goals and things.
Correct. One additional advantage of the MOU is to avoid duplication. Another advantage of the MOU is to make sure that we can share infrastructure. The avoid duplication part is important. If the Ministry of Health is already providing service A in state B, the NGO shouldn't really go in and provide service A in state B. If the MOH is not able to provide service C, for example, then the NGO can step in, and that sort of MOU will be able to avoid duplication and to share resources. So that's my second idea. The first one is a secretariat, it's a clearinghouse to share information. The second one is an MOU or partnership, a legal agreement, whatever you want to call it.
But talking about the MOU, has there been in history MOUs, partnerships, for example?
There have been. Enough examples of MOUs with the NGO circles in Malaysia. The challenge is that, two challenges. The first one is, we talk a lot about public-private, we don't talk a lot about public NGO. So I think we should use this as a term and move towards that direction. The second one is there's still some reluctance in publicizing a lot of these MOUs that have taken place in the past. The reason for that is the government feels that an NGO is performing a role that I should perform. And because of that, they might feel a little insecure.
Hence, government becoming defensive.
Correct. My legitimacy is under threat, for example. There is a clear role for NGOs, and I don't think they're in competition with the government. If you allow NGOs to come and play in that space, it doesn't mean that the government's ineffective or inefficient or corrupt or totally useless. And I think there should be enough of a confidence, really, to partner them, which leads to my third example. And this requires a bit more of a psychological change. This government that we have in Malaysia has got a strong technocracy. The technocracy has seen one change in government at least, and it survived the change in government largely intact, with good policies, good policy makers, and very highly trained and capable people inside the Ministry of Health. The kind of psychological confidence that can come in, or institutional confidence in my abilities, my talents, and my, delivery impact, right, can then make them feel better about partnering with NGOs. So my three ideas are, firstly, the secretariat, share information, clearinghouse, coordination. Secondly, MOUs, or utilizing public NGO partnerships a lot more. And then thirdly, having the institutional confidence that we can allow some space for a vibrant civil society to come by. And it's very important because the Malaysian government, or any government for that matter, internationally, often has a very conflicted relationship with the private sector. We want them, but we kind of don't want them. NGOs, we want them, but we kind of don't want them too. Yeah. So some institutional confidence, plus a secretariat, plus a clearer MOU pathway or public NGO partnership pathway, I think would be helpful.
All right. Thank you, Dr. Swee Kheng. We talked to our guest today, who is the Senior Fellow, Health System and Policies, University of Malaya. Thank you so much, Doctor, for your time. All right, and thank you for watching. This is Health Matters with me, Dishen Kumar. Today's topics were NGOs, marginalized communities, how NGOs and the government should work together to take care of our brothers and sisters in Malaysia. So I hope you enjoyed this show. This is Health Matters with me, Dishen Kumar. Thank you. Goodbye.